I kept repeating my mistakes of not reviewing, because if you don't review, you don't know what mistakes you're doing, and you'll keep doing them over and over. I submitted, and nearing the result time, it's where it was my breaking point, where I had to take some time off work because I just couldn't go and work. I was too overwhelmed to even start my day. So it had basically turned into generalized anxiety, where I couldn't even make tea. The thought of passing the exam probably kept me going. This exam is not a sprint, it's a marathon. So take it slowly, enjoy it. You have 6 months to record. You can learn a lot in these 6 months.
Welcome to this episode. Today I'm joined by Dr. Sana Khan, who recently passed the RCA. Thank you for joining us today, Sana. Welcome on this channel. Would you like to introduce yourself for people who might not know you?
I'm Dr. Sana Khan. I am a GPSC 3. I'm from the Leicestershire Deanery, and I have recently passed my RCA, and very soon I'm looking forward to CCTing.
That's great. Congratulations again for passing the RCA. Tell us, how was your preparation?
Well, this was my second attempt. In my first attempt, I submitted in January, in January 2022, and unfortunately I couldn't make through. It was a marginal fail, and for that I had started preparing last year, end of July, when I had started making the recordings. And my pitfalls through that journey actually gave me the insight as to how I should approach the RCA this time around. So in my previous attempt, I was very pressured, as in I've got a small child, I've got a husband who's also a full-time trainee, and he's got his things to do and his exams to do as well, and I'm a part-timer as well. So there was a lot of pressure regarding that, and the portfolio pressure, and you carry that on. Probably not the right perspective of knowing what to do for the RCA, not asking for help. I did not ask my my practice to make any special arrangements for me. Probably just in the last month, in the month of December, that I asked them that I would be coming on the days that I'm not working, because it was much easier for me to pick cases. And I wouldn't be stressed about the list that I had in the rest of the day. I was doing 10 minutes, probably that was the arrangement. I was doing 10 minutes, I'd come down to 15 minutes to record for my RCA sessions. I did not involve the reception team much. I did not exchange cases. I just tried to manage with whatever I had on my case, on my list for the day. And the biggest blunder of it all was I was not reviewing my recordings very frequent. In fact, I on the list that I put out for my exam, my final list, I just remembered what I had done. I had actually not reviewed them. I just had the memory of what I had done, and because I was too anxious to listen to my recordings. And that was the other thing that happened, that mental stress that led to anxiousness and not asking for feedback. All of it basically went against me. So this time around, I knew that I had to change that. And so basically started off with getting support to help me with my caring for my son and the family. So I called my parents. They are in India, so I called them to help me. And even my husband was having his exam, so even more that we needed their help to support us during this time. So I sought out help. The second thing was to prepare myself again mentally, that I would be hitting the anxiety point again. So I had my counseling sessions, I had the PDs involved, I had my CS and ES know about my situation. I was provided with professional support. I was supported by the PSWs as well. So I had the whole team with me, supporting me throughout. So asking for help is the second thing that I did, that I knew that I was going to reach a point where I would be having that anxiety issues that would interfere with my performance. So getting help on board, asking for help is very important. Preparing as well. I had a study group where we discussed case scenarios initially and prepared ourselves with that. Then coming to recording, I submitted in September. So I started recording mid-June for it. And initially not being too hard on myself, not being too tough, started recording, giving it time and listening to myself and seeing where I'm going, obviously trying to have that mandatory criteria, hitting the mandatory criteria, those kind of cases in mind. Then as I proceeded on, I felt that I was more comfortable doing the telephone consultations because I could have a crib sheet where I would quickly write a mental map or a template, as they say. That if I know that the case is about a headache, then I would be writing ICE, I would be writing psychosocial, I would be writing the red flag signs, the differentials, examination as a cue in case I need to offer examination. And in management, I would write down something like an I, which basically means starting with the idea of the patient, and then the diagnosis, what I think was happening with the patient, and the expectation, so E for the expectation of the patient, and then the management. So if the patient thinks they need a blood test or a scan, and what I think about, and if we are going for it or not going for it, and giving them the reasoning. So the management was just this framework because it was tailor-made for the patient. So that was my strategy going forward. And keeping time, my phone had a display, a timer display, so I could see second by second how much time I had. So I was pacing myself up and down, giving the time that I had. Then I also wanted to try out face-to-face because my practice was, we have half our session as face-to-face and half as telephone. So I wanted to utilize my face-to-face consultations as well. So I started recording, but the problem I found was that I was not orientated to time. I tried keeping a timer, but I did not have the nerve to look at it because I thought I might break the rapport or it might just look odd. I still had that problem even till the end, but since I practiced so much, so doing a lot of cases helped me develop that physical memory of doing it. So it would be paced to the point where I was managing the time all right. And at the times when I'm getting up to examine the patient, I would have a quick look at the time clock. Okay, it's about 5 minutes, 5.5 or 6 minutes. Then I know how much time I need to spend for that. Quickly do it in 2 minutes. So obviously choosing those kind of cases in face-to-face where I can do things early, like quickly, and avoiding those where the examination would take a lot of time. And so that was my strategy with and I had a mix of face-to-face and telephone. Submitted 6 face-to-face and 7 telephone consultations, and then reviewing them as well. But I wasn't reviewing them that frequently, so probably once in every 2 weeks that I was doing that. And then at one point I had that block where I felt that my recordings are not improving, and where I contacted yourself to help me get past that obstacle, because I just found myself in a deadlock and I don't know how I could do things to improve myself. So I joined your course, in which I found that it was very helpful. You gave me an insight into my consultation. I looked at it with a different perspective, and you made me realize on where things are getting flawed, and it made me realize and self-conscious. So when I would review my cases, those pointers, those advices that I received from yourself, I would keep that in mind. And when reviewing my cases, I would have those things in my mind, and even marking my cases as well. You gave me a good insight into marking my cases, which made me give like a reasonable mark to it. Obviously I'm not an examiner, I wouldn't know for sure how much that would be marked out of, but at least I knew that this would cross the mark. This would make it through. This case will make it through, or this case will not make it through. So I had like a broad idea about how to go about it. And then you also advised me that instead of doing it every 2 weeks, do it on a daily basis. You would learn from every day reviewing your cases, and you can improve each day rather than waiting for 2 weeks and seeing it, and then that basically slows down the progress. And definitely getting a lot of feedback from my education supervisor and my clinical supervisor. Thankfully, I had 2 of them, so I could divide my cases and show them the ones that I was maybe on. So the ones that I did not like, I would obviously not show them. The ones that I was sure that they're good enough, obviously it wasn't worth their time. It was those borderline cases where they could help me decide whether it's good enough to keep or whether I should discard it. And then making arrangements with my practice as well. Since I'm part-time, I went on days, much earlier on days that I wasn't in, and they would set like a list of 5 GP bookable slots where I would pick and choose from other people's list. I'm not tensed, I'm not pressured with time, I don't have a list of patients waiting for me. So those things did help me with my anxiety as well, that I felt much relaxed doing it and on those days. And some of my colleagues as well who are full-time did it in those the self-study time that we get in our rota. They utilized that time to do their recordings, so it's helped them. And then I had a special date on a Thursday dedicated just for recordings. So I just had 13 slots, which is almost like half my day in true sense. And I would pick and choose from other people's list, and the slots that were empty, then the receptionist could just fill them in if anything was left. So I was utilizing those slots as well. So all of that helped, and keeping myself calm, practicing mindfulness. And the other thing that helped me with my anxiety was actually giving a thought to what I'll do if it is the worst case scenario. The worst case scenario is that I don't pass again. What would be my strategy then? What would I do next? So that also helped me calm down. And advices from you as well, that taking this as a game, as a challenge, and starting with a smile and having a positive outlook, because someone who's failed, every case is daunting because it brings back bad memories from the past, and to forget that and take it like, this is a case, how I'm going to manage it, this is my challenge, how I'm going to break this. So that's what I followed and went about it. Now with my cases, what I realized is playing to your strengths. So things that you're good at. I later on realized, because we do so many mental health cases, that mental health cases kind of became my forte. I was doing them in time. My rapport with patients was good. My management was fine. So mental health cases were my forte. So I was making the most of them. Then recurring cases that you will find day to day. So like cases like tired all the time, vertigo, headaches, abdominal pains. I kept doing them over and over. And I realized that HRT cases, I realized that the first two or three might not be that good, but by the time you're in the 4th one or the 5th one, you already know the questions, you already know, you have that pace, you know the examinations, you're pro at it. So it just keeps getting better. So choose that recurring theme that you would know your practice, you would know what kind of cases come to you. So keep doing it and you'll just keep getting better at it. So yeah, so that was those were the things that I did this time, and it paid off. So it was it ended well, basically.
Yeah, that's great. So your effort paid off. You actually changed completely the way you approach the RCA second time round, because oftentimes I see registrar fail once and then take it again soon after, and then they realize they've not done very well, and sometimes even do worse than the first attempt. So it looks like you actually took your time, and you gave yourself a few months to think about things, and then when you were ready, then you went back to recording.
So the first time round, the anxiety had hit me really bad, and I didn't think that I would be picking myself, because then the next one, I couldn't obviously do the March one, then the next one was April, and I felt that I wouldn't be ready for the April one. And after April, it was the September sitting. So at that time, I didn't feel that I was in the right mental frame of attempting the April exam. And if I would probably be failing myself again. So I gave myself that time to and I had some therapy sessions as well. So I made myself mentally strong and had a plan before I went ahead with things. So planning this exam is very important.
Planning, organizing. You mentioned about getting better with your mental health, and you had therapy. So the anxiety problem, is it something that started like during your first attempt, or is it after the first attempt you found that after the result and you were feeling more anxious?
So I think the anxiety set in as I was doing the recording. So I started in end of July, and I was actually aiming for November, but I didn't think that the cases were going as I expected, and that kind of keeps building the anxiety up. So from November, then I postponed it to January, and then I had to give myself a deadline, because you can never be ready for an exam. So I gave my deadline that I'm doing it in January, but I kept repeating my mistakes of not reviewing, because if you don't review, you don't know what mistakes you're doing, and you'll keep doing them over and over. And when the things are not going right, the anxiety keeps building on. So in December, I think I hit my peak where I basically wasn't even sleeping at night. So with probably 2 or 3 hours of sleep, I would be at work next day and again trying to record. So things are not going well. And I submitted, and nearing the result time, it's where it was my breaking point, where I had to take some time off work because I just couldn't go and work. I was too overwhelmed to even start my day. So it had basically turned into generalized anxiety, where I couldn't even make tea. And it had reached that point where I couldn't function properly. So I had to take some time out of work and relax and reflect, and then come back to work, stand up again, and hold myself up again.
Sounds like you've gone through many challenges. While you were going through these challenges and you had to sit it again, what kept you going?
The thought of passing the exam probably kept me going. The thought of victory. So, when you are approaching this exam, think about the good thing that will happen. Passing the exam, becoming a GP, doing what you wanted to always do. So the positive things about it, rather than remembering the negative things about it. Reaching the peak and actually putting my flag there was the thing that kept me going.
So if we talk about the practicalities, when you are feeling nervous and had this anxiety, because I can appreciate it's very difficult to consult doing an exam when you're not very well in yourself and having anxiety. What were the strategies that you developed to build your confidence, Sana?
Because I had problems with palpitations as well, and had come to the point that it would actually give me physical, chest discomfort. So I was taking propranolol. When I had signed up for sitting in September, again, it peaked to the point that I was completely in a meltdown, and I had a discussion with my GP whether I should start on an SSRI. And then they said, by the time the SSRI works, you might be submitting. So do you just still want to hang there and see how it goes, and just in case if you are worsening, you can let us know. So I knew that I had a lot of support. If things worsen, I can always ask for help. And even my PD knew about it. In fact, she told me that if you're still not feeling very ready for it, even after you have that window period where you can still say that I'm not submitting this time, so they'll hold your money and you can sit the next sitting. So asking for help and asking right people for help also helped me with my anxiety issues. The mornings used to be the worst. Starting of the day used to be the worst. It's just, you know, that whole build up and overwhelming feeling. But when I would start consulting, it would just ease down as the day went by. So just so I had to keep myself, you know, brace myself till I knew that once I am going to start my day, it'll get better because I will be distracted. So it was about that. It did take a lot of strength, but I kept pushing myself.
Yeah, I understand that you did struggle a lot. One of the things that's quite common with the RCA is performance anxiety, because you're almost
Yeah.
performing for this recording. And sometimes registrars struggle a lot when the camera is on or when the recording is on.
Yeah. So the way around it is I have probably recorded around 250 cases. So the more you record, the better you get, the more ease you get with the camera, the more ease you get with hearing your own voice. And so the more you do, the better you get, is the strategy. So there are people who I know have, you know, from beginning to start, it was just 4 weeks and they've done it and they've passed. And there are different personalities, and I would probably each one to their own. Some people had recorded nearly 500 recordings, and so, you know, double than mine. So I think you have to know how you are performing, what you want, and you know, go about it and see how many recordings it takes to ease yourself into that.
That's a good approach. So the more you expose yourself to the recording, the less sensitized you get. So almost desensitizing yourself from this, and you get more comfortable with the recording. So let's talk about your cases, Sana.
Children, I prefer doing face to face, because you know, you have the child, it's easier to build a rapport, you know, face to face rather than over the phone. And you can interact with the child as well, and interact with the parent. It helps with the interpersonal skills. It helps with them trusting your decision of the management plan. So and you have the child and you have examined, so you're reassured as well about what you're talking about. So I like doing children with face to face. Any sort of, if it's abdominal pain, it should be face to face. I avoided things like headaches or vertigos doing face to face because the examination would take me longer. I've probably done a thyroid case that was a face to face case. So anywhere where the examination is swift, I prefer doing that face to face. MSKs as well. I did a lot of MSKs, but unfortunately I wasn't finding the right kind of complexity, because I would think whether a physiotherapist could do this, and we have our in-house physiotherapist, and if the answer was yes, there was nothing else that I've done, like, so I would have to discuss. Otherwise, you know, MSK cases, back pain cases, shoulder, knees, they're very good to be done face to face. But if there is anything else that you can add to it, what a physiotherapist can't, like carers, or if they are depressed because of they can't mobilize, and you've managed the depression side of things, and address the psychosocial. So to get complexity in the MSK cases would be important. Otherwise they would be probably low challenge ones.
If we break down the mandatory case selection criteria, can you remember the cases you submitted? For example, what did you submit for the long-term condition?
For the long-term condition, actually, I struggled with the complexity of cases. I chose a mental health case to help me with my mental for the long-term condition, because the patient had tried many antidepressants in the past. She was on venlafaxine. She had to get, you know, reduce the dose because she was getting side effects from it, like sweating and so on. So, and when that happened, her anxiety worsened, and she had called up, but her blood pressure was also on the higher side. So I had to discontinue the venlafaxine, and the only thing that she hadn't tried was paroxysm. So that there was a bit of medical complexity to it, and there was an ongoing issue. So I chose that because, again, you know, all those COPDs and I tried them, the MSKs, the osteoarthritis, but I wasn't getting the right complexity. And mental health is something that is complex, and itself. So I chose that as my long-term condition.
That sounds like a meaty case that you chose. Do you remember for the other mandatory selection criteria, Sana?
For the child case, I had a child with limb pain, so it was growing pain, but it was unilateral, and mother was scared about cancer. The second one I chose was constipation in an 8-year-old, but he had mental health issues and a possible autism, ADHD. So it was behavioral problems that he was having that led to his constipation. So managing that as well. So then that was something. These two, I had another. It was a child, but I chose that as an acute case. It was right iliac fossa pain, query appendicitis, so I had to send to the hospital. The other acute one was suspected ectopic pregnancy that I had to send to the hospital. Those were the two acute ones. Then I had 2 other mental health cases. I submitted actually a total of 4 mental health cases because I know the recommendation is 2, but it's not mandatory, and I felt I need to play to my strengths, and my mental health cases were better, so I ended up submitting 4. So the one was worsening health anxiety, and one was depression, new presentation. So those were the mental health cases. And then for the gynae, the sexual and reproductive health cases, I had one was an HRT case, and the other one was I'm not sure whether it was a PV bleed. I probably don't remember that very clearly, but for long term it was mental health.
When you mark your cases, then you were optimizing for higher score, which is why you opted for 4 cases of mental health. You mentioned that you were more objective this way. So would you be happy to share with the audience what was your score?
I scored 149. And in my previous attempt I had scored a 136, so that there was definitely an improvement. I did wish to score, in my head I was probably around 158, 160 in my marking, but I'm not an examiner, and obviously it went to the hands of the exam. So when you are marking yourself, you need to make sure that you are giving your best. So if you're thinking that case is an 8 or a 7, then probably you might be 1 or 2 marks down, depending on what you have not realized and how the examiner is looking at that case. So you have to keep that margin. So don't be like, strictly this is a 6 and it's fine, or 5.5 and that's fine. You should be aiming for 9, really. Like, try your best. Try to give your best shot.
Yeah, ideally you want to give yourself a margin of safety. So you're submitting your best cases, and even though if the examiner might score you slightly less, you still pass, as in your case, you managed to pass. And at the end of the day, it's just an exam you need to pass to CCT. If you have scored slightly higher or lower than what you expected, it's still a pass.
A silver lining is that you've passed, you made through. The good grade is obviously you feel happy, you feel satisfied. It's to your joy. And otherwise, yes, the basic thing is that you've passed the exams.
Yeah, that's great. I mean, I can see you're much more at ease and comfortable now, because you were very stressed during the preparation. And I'm really glad that you managed to get the right support, because this is so key. Because doing this exam is so difficult, and without support, it's really difficult to get through it. And it sounds to me that you sought help and you got the right help.
Thankfully, I was lucky enough that I had a practice which was very compliant and was not a stumbling block, because I could see that a lot of trainees had difficulties with getting the right kind of cases or getting their practice to be on board with them. So I was lucky in that way, that my practice was very supportive. My PDs were supportive, and I was given the professional help as well. So all of that has contributed to me passing this exam.
If you had to speak with somebody who was in the same exact position as you, failed the first attempt, very demoralized, anxious, and if they had to have one piece of advice from what your experience been, what one piece of advice would you tell that person?
This exam is not a sprint, it's a marathon. So take it slowly, enjoy it. You have 6 months to record. You can learn a lot in these 6 months. And housekeeping is very important. Taking care of your mental health is very important. This exam, so if you do 3 recordings or 4 recordings, some days none of the recordings will go well. Some days 1 or 2 will go well and the rest will not go well. Celebrate the achievements. Don't be too distressed about the failures, because you have another day. It's, you can keep improving, and the more you do, the better you'll get, and that's for sure. So people who have failed the last time or were a marginal fail, 1 or 2 marks, you're there. You've got it. Just a bit of tweaking would help, and reflecting on the feedbacks that you receive from your exam, the feedback pointers, and discussing that with your ES, and how would you approach it next time is important. So for passing it next time, just stay positive. It is a tough exam, but it's not impossible, and you're there. You just need a little bit more to cross the bar.
You mentioned how this is a marathon, not a sprint, and yeah, because the RCA is psychologically very draining. And if you're so dependent on getting a good case every day, and you're beating yourself if you haven't got one, then you're going to get demoralized. But if you focus on the progress, making one foot in front of the other, then you focus more on developing your skills and getting better. And you'll get good cases as you keep going.
Yes, definitely. And you'll realize that towards the end, that how good your consultations sound than how what it was when you started recording. So it definitely, and overall you just become a better doctor for sure with this experience.
So you mentioned that you got in touch with me back in July. What was it that you thought was very useful about the one-to-one coaching?
So I had seen your videos on YouTube, because I did watch videos on YouTube, the CSA videos on YouTube, and your videos as well on how to approach certain cases, and also saw the interviews of the IMGs or other trainees who passed the exam and their challenges, and it felt like if there is a stumbling block and you're not able to find the answer, your CS or ES is not able to find the answer, probably a third person can find you the answer. So then I felt that because I had real respect for you, seeing your videos and your approach, so I contacted you, and it definitely did benefit.
I'm glad how this goes full circle. You watched the video, now you are one of the persons that I'm interviewing today, and maybe somebody is watching this and thinking how they're going to prepare for the exam. Thank you very much for sharing your experience, your story, and the challenges that you went through, because this is very inspirational for somebody who is struggling at the moment. So what's next for you, Sana?
So I'm going to, I have received an extension till April, so I'm going to ask for an early RCP, because I was given that provision in my panel that if I pass the exam, I can ask for an early RCP. So I'm in that process of that appeal, and then hopefully once I CCT, looking forward to initially locuming and seeing the practices, and then if if there is any practice that I feel more comfortable with, then probably thinking of being a salaried GP there, and seeing how life goes, basically.
Sounds good. I mean, yeah, it's good to test the water and locum and see what's available. And then once you find a practice where you feel you can settle, that fits you, then you can settle. There's no rush. Thank you very much for joining us today. If you have any questions or if you're not sure about things, then please write it down in the comment section. If you have been struggling with the RCA and have realized that doing it on your own might not be the best use of your time and resources, then book a call with me to see whether I can help you. If I can help you, then we can enroll you on the one-to-one coaching program. But if I can't, then at least you'll get some insights in your preparation. Click the link down in the description below to book a call. Take care, everybody. Bye-bye.